Laboratory diagnosis of the HIV infection. The laboratories play a very important role in the HIV management. When HIV testing is performed for the early diagnosis, blood donor screening, confirmation of infection, monitoring, treatment, and preventing mother-to-child transmission. The main objectives of the HIV diagnosis of HIV testing اللي هي early diagnosis ال HIV and the blood donor and the blood donor screening. مهم جدا في بنوك الدم نعمل screening لكل ال health donor for the HIV. Confirmation of the HIV infection, start ال ART after confirm الانفكشن، start ال ART monitoring أو متابعة أو follow up أو لل ART effectiveness on a viral load, prevention of mother to child transmission by the screening and mother and pregnant woman. There are different type of the systems can be used for the HIV testing. And here serum or plasma are the most common sample used for the diagnosis. A plasma is preferred for the molecular tests such as a PCR or whole blood with dried blood spot are useful in some settings, especially low-income country, especially for the newborn and remote area اللي هي الاريا اللي ما فيها diagnosis. بناخد dirty blood spot and send to the other laboratory which have this other technique to diagnose of the patient. There are different laboratory markers appear at different times after infection. When the HIV RNA is detected first, followed by the B24 antigen, then the IgM antibodies, and finally the IgG antibody. Understanding of these sequences help explain the wind period. What I mean by wind period? The wind period is the time between an HIV infection and detectable laboratory markers which are found in the sample of the patient. That means that in the first infection, we found the HIV RNA in the 7 to 10 days after infection, and B24 antigen found 14 to 18 days, which used in the fourth generation of the immunoassay, and HIV IgM antibody found in the 3 to 4 weeks after the infection, and HIV IgG antibody found after the 4 to 6 weeks of the infection. Here is the different laboratory method which we use for the diagnosis of the HIV patients. We can use the screening test. For the screening test, we can use a fourth generation HIV, which depend on to detect the GB antigen, الBG antigen, الimmunoassay preferred, الرابid HIV antibody RTD اللي هي rapid diagnostic test. Confirmatory test, this is screening. We need to confirm screening test which become positive. We use a confirmatory test like a different immunoassay to differentiate between which type of infected patient. It is HIV1 or HIV2. After that, we can use also a PCR as a confirmatory test HIV nucleic acid for the inclusive result اللي هي الريزلت المشكوك فيها. Other tests we can use a molecular test which you can use for diagnose the patient هي HIV RNA الviral load quantification مهم جدا في treatment of monitoring the patient. early infant diagnose if a mother is infected with HIV. How we can monitoring the HIV infection and monitoring the HIV infection by the different methods اللي هي we can assess the viral load اللي هي gold standard for monitoring of HIV infection or to follow up a patient who infected by the HIV and use the ART. A viral load is a gold standards and detectable viral load show that treatment is working well. A CD4 count also we use to measure immunoinfection and help predict the risk of opportunistic infection. First, we use a viral load as a gold standard to measure HIV RNA copies, and we use for the monitoring RT responsible detect treatment failure وبساعدنا في detect إن في failure في التريتمنت. الكور ستاندرد الهدف الأساسي اللي هو undetectable viral load. لو لقينا viral load حصل له قد معته treatment حصل له response good. A drug resistant, we use a genetic resistant testing test to test which gene resist for the drug. Perform in the case of virological a failure or before changing the ART, or when we find that is increase in the viral load after starting ART treatment. A CD4 T cell count also we can use to assess the immune cells of the patient. بريدكت بتورينا انه كل ما حصل decrease في الكاونت هالسيل بتوقع انه في opportunistic infection risk develop in this patient. Use also for monitor immune recovery after ART. بتستخدم ايضا to assess the immune status of the patient after start ART. إذا جينا للnormal CD count is usually above 500 cells per microliter. Counts between 200 and 5 indicate moderated immunosuppression, and the CD4 count below 200 is one of the criteria for the AIDS and indicate the high risk of the serious infection. In this diagram, we summarize screening or diagnostic testing for the patient who infected by the HIV. First step, we get the samples. Sample after that tested for the HIV 1-2 antigen antibody combination test. If non-reactive, it is a negative result for the HIV. If reactive, step 2 is to differentiate between which type of the HIV1 or HIV2. HIV1 reactive, HIV2 non-reactive, it is a positive for the HIV. HIV1 non-reactive, HIV2 reactive is HIV positive. HIV1 and 2 positive, that means it is reactive for the HIV. HIV negative, it is negative or intermediate. HIV negative or intermediate, we can do a nucleic acid to discriminate is it reactive or non-reactive. It found non-reactive, it means it is a negative for the HIV. All these samples which found some of them it is positive, we need to use a detectable, we need to use a molecular technique to confirm, or a Western blot to confirm this patient is reactive or not reactive. It's reactive, we use it is diagnosed as a acute HIV infection. After that, to start a treatment. This is a new algorithm which approved by the CDC, اللي هي first step اللي هي fourth generation of the HIV test. Any company after that, any company use fourth generation immunoassay. After that, negative is diagnosed as negative. If positive, we use another test اللي هي الانتيبودي to differentiate it between a negative or intermediate or positive. اللي هي intermediate result as a negative by the use of two different immunoassays. Negative or intermediate, we use a nucleic acid to discriminate it out to differentiate is positive or negative. Negative is a false positive, diagnosed HIV negative. Positive is diagnosed as acute HIV positive. This is a test which use in the different laboratory for diagnosis suspected patient infected with HIV. We use first ELISA technique, agglutination test اللي هي initial screening test, Western blot اللي هي أو immunofluorescence test use as the confirmatory test, B24 antigen early marker of infection, detection of a recent infection, viral RNA real-time PCR, confirm treatment efficiency, detection of a recent infection, CD4 or CD8 ratio, staging the disease, بتورينا the stage of disease, and confirm treatment efficiency, viral isolation used for the research. Let us talk about the treatment. What happens when the result is positive? There is currently no cure of the HIV. لحد الآن ما في cure from the HIV, but effective treatment allow people with HIV to live long and healthy lives. The goal of the treatment is to suppress viral replication, protect our immune system, and prevent a disease progression. يبقى the treatment which used for the HIV is called the HART. HART means a highly active antiretroviral therapy. This treatment available since 1995. The benefit from this treatment mainly suppression of viral replication, halt the damage to the immune system, partially restore the immune system, partially restoring the immune system infection. الكلينيكال benefit اللي هي fewer opportunistic infection و longer life for the patients healthy. In this slide you can see the different classes of the antiretroviral drugs which used for the treatment of the HIV. Currently WHO recommended first line of ART اللي هي تينوفيرا اللي هي نستخدم شنو التينوفيرا the first which used for the first line. This is the first line of drug. After that also we use الليمفودين ده the next the next type of drugs which approved by the WHO. HIV develop a resistance to remutation during viral replication. كيف بيحصل develop resistance البور adherence للميجر causes of resistance اللي هي combination. عشان نقلل الريزيستنس WHO عمل combination of more than 3 drugs delays the emergency of the resistance. HIV medicine work by blocking a different step of the viral cycles. Drug classes include the reverse transcriptase inhibitors, protease inhibitors, integrase inhibitors, fusion inhibitors, and CCR antagonist. Using a circle drug together reduce the chance of the treatments. يبقى الكلاس بتاعت الانتيريتروفيرال اللي هي مقسمة لشنو؟ مقسمة للنيكلوسايد نيكلودايد reverse transcriptase inhibitors and non-nucleoside reverse transcriptase inhibitors, protease inhibitors, fusion inhibitors, CCR5 antagonicity and integrase in standard transfer inhibitors. دي الكلاس حق العلاج أو التريتمنت بتاعت الانتيريتروفيرال واللي هي different targets area for these classes. WHO recommended use first line for the treatment patient of the HIV use more than 3 different type of the drugs to avoid a resistance of this drug. But HIV developed a resistance through mutation during viral replication or poor adherence is a major cause اللي هي عدم التزام بالتريتمنت اللي هو major cause of the resistance. WHO recommended use more than 3 types of drug delays the emergency of the resistance. With resistance testing we need to do genotypic testing or resistant testing before changing or before starting ART. عندنا poster protease inhibitor have the highest genetic barrier to the resistant, meaning making them preferred option in current treatment guideline. In this slide we discuss how we can prevent a disease اللي هي prevention of the HIV infection. Prevention of HIV infection اللي هي combine of many factors اللي هي combines of the behavior, biomedical and the public health intervention. Primary prevention اللي هي practice safer sex اللي consists on correct condom use, pre-exposure prophylaxis اللي هي daily or long acting medication of people at the high risk, or by post exposure prophylaxis بعد ما يحصل infection اللي هي start within 22 hours of potential exposure on continues for 28 days. إذا حصل لا قدر الله أي حد فينا شغال في الميديكال فيلد معرض إنه يحصل له inject by the syringe or by the sharp which is contaminated with fluid body fluid from the patient infected with HIV. We need to start or use or post exposure prophylaxis. regular HIV testing. early diagnosis enable timely treatment and reduce transmission. واحدة من الخطوات المهمة جدا في عملية prevention لل HIV infection screening البلد البلد donors والorgan donors اللي هي mandatory testing before transfusion or transplantation mandatory في كل دول العالم. standard infection control اللي هي البيشنت أو not patient health worker which work in the medical environment. we need to use hand hygiene, PPE and the safe handling of a sharp in the healthcare setting. preventing of HIV transmission. كيف نمنع transmission لل HIV during treatment itself is not important to prevent is not only preventing a transmission. People with undetectable viral load and do not transmit the HIV through sexual contact. Other prevention methods including pre and post exposure after an infection prevent another treatment. يبقى treatment as a prevention ممكن نستخدم some antiretroviral therapy for all people living with a patient who are infected with HIV. Achieving and maintaining an undetectable viral load prevents sexual transmission. prevention of a mother to child transmission. routine HIV infection لكل pregnant women. immediate one when a pregnant woman infected with found infected with HIV, start immediately an ART for HIV positive pregnant woman to prevent the transmission to child. When a child infected, start antiretroviral prophylaxis after birth from infected mother. Abbreviated infant feeding based on a national WHO guideline. نمنع نحاول الطفل ما يتعرض لمنه البودي فلويد ذات breastfeeding from the mother infected by the HIV. early infant diagnose and follow up if mother is infected with HIV. الببليك هيلث ميجرز. كل الببليك هيلث وكل المينستري اوف هيلث مطلوب منهم ان يعملوا HIV education and awareness programming of all community. volunteer counseling and testing. نشجع الكوميونتي ان يكون في انه any person come to counseling and testing for the HIV. prompt notification and testing. harm reduction programs for people who inject drugs. لازم الناس اللي بتاخد inject drugs needless feeding sharing نعمل لها توعية انها ما تصدم حاجة. most effective HIV prevention strategy is the combination. عشان نمنع ال HIV infection هي strategy هي the combination early diagnose lifelong ART pre post exposure prophylaxis safe sexual practice blood safety and infection control الماتيرنتي أو المother to child transmission اللي هي الماتيرنتي program مهم جدا في عملية الترانسميشن. That is all for the HIV. I think that is I give you a lot of information about the HIV from basic science to treatment and prevention. Thank you for your attention.